Disclaimer: this presentation is for educational purpose only. How you use this information is your responsibility. We will not be held accountable for any illegal activities. In order to attend Penn State, you are required to get the MMR vaccination, which vaccinates for measles, mumps, and rubella, in addition to the meningococcal vaccination.
Each college establishes their own requirements for vaccines and immunizations. However, in Pennsylvania, it is the law that all students must complete the meningitis vaccine before moving into a residence hall or be able to sign a waiver. All students may have a moral or religious exemption. They must write a letter and sign it and have it on file in the health center.
And we have other anti-vaxxers today who aren't only worried about autism. There are the delayers like Rand Paul.
We sometimes give 5 and 6 vaccines all at one time. I chose to have mine delayed.
There are deniers of all stripes. They're the Orthodox Jews in Brooklyn. They're the parents of children with medical conditions who have to opt out. They're even unvaccinated kids visiting Disneyland.
Penn State recommends you get these vaccinations because of the close quarters that we live in within residence halls. However, what happens if you choose not to? What are the ramifications of such a decision? More importantly, is Penn State, and in general, the whole population, being overcautious or not cautious enough when it comes to vaccinations? Vaccines are essentially a solution of dead or weakened viruses that are injected into one's body. Therefore, our bodies can make antibodies that are capable of fighting off illnesses before we ever contract them. If we end up catching the illness, our body's defense response will therefore be faster.
There are many advantages to getting vaccinated, and some are: they save children's lives. Ingredients in vaccines are safe in the amount that they use. Major medical organizations state that vaccinations are safe. Adverse reactions to vaccinations are extremely rare. They also save parents money. Vaccinations also protect future generations, and they also provide economic benefits. Vaccinations also they keep people safe from those who do not vaccinate.
These vaccines work so well that the memory of these diseases has faded.
So why is there a controversy in the first place? Well, we can attribute that to Andrew Walker and 12 of his colleagues. They published a case series in The Lancet in 1998 which suggested that the MMR vaccine may predispose children to behavioral regression. In other words, autism. This case, however, was very poorly founded. They only had a sample size of 12 patients, but the issue was it received such wide publicity. So the result of this was that MMR vaccination rates dropped because parents were so concerned about giving their kids autism. Later, we found out that 10 of the 12 co-authors retracted their interpretation of the original data. They said there was no causal link between MMR vaccines and autism, and that their data was insufficient. We later found out from an admission by The Lancet that this trial was wrong because of financial interests. Lawyers had funded this project because they had parents that wanted lawsuits against vaccine-producing companies.
One discredited paper made many parents think that there was a link between the measles, mumps, rubella vaccine and autism.
The parents understand it, they get it, because they've lived it.
The message from the BMJ could not be clearer or more shocking. Wakesfield research, they contend, has been a fraud.
Within the last 3 years, there have been several cases of mumps. Also, several years ago, there was an outbreak of pertussis on campus.
Along with that, a lot of safety testing goes into vaccine use. When a new vaccine is found and being contemplated, it is tested and regulated many times, and it continues to be tested until it receives its license. Along with that, the vaccine is closely monitored indefinitely even after approval. The American Academy of Pediatrics works closely with the Centers for Disease Control and Prevention to make recommendations for vaccine use, allowing citizens in the U.S. to be reassured that the vaccinations they are receiving are not unnecessary or will not be helpful in the future.
The history of vaccines is clear. If you start to decrease vaccine immunization rates, you start to see the diseases reemerge. It's a history that we don't seem to learn from.
Paul Offit is an infectious disease expert. He helped invent a vaccine to protect against rotavirus disease, which kills hundreds of thousands of children worldwide. As a pediatrician, he's witnessed firsthand children dying from preventable diseases.
I guess we all have our biases. Mine is that I work in a hospital. And so, for example, in 1991, in the city of Philadelphia, there was a massive measles epidemic. Of the 9 children who died during that 1991 epidemic, 7 of them died in our hospital. So we had to stand by and watch while we tried to support them. And as doctors, your job is to try and save children's lives. And when you stand helplessly by and watch them die, it gets to you.
The majority of last year's massive uptick in measles cases actually involved the Amish of Ohio. More than 350 people there were infected by one man who had traveled to the Philippines. These outbreaks of vaccine-preventable diseases in the U.S. typically happen just like that.
Lots of adults and parents of children have many concerns and sometimes misperceptions about vaccination. Some people can experience allergic reaction or hypersensitive reaction to vaccines. Although the occurrence of allergic reactions to vaccines is not known, estimates range from 1 per 500,000 to 1 per million doses for most vaccines. Parents also raise concerns about vaccines leading to autism. These concerns lead to under-immunization in both children and adults. Among children, a 2010 study showed that approximately 22% of parents intentionally delay vaccinations. Among adults, only about 37% of healthcare workers received the seasonal flu vaccination and the H1N1 vaccine in 2009 to 2010, despite the national attention to the H1N1 pandemic.
Michael Troyan of Penn State's Biochemistry and Molecular Biology Department feels strongly that the population should be vaccinated. Some people, for various health reasons, cannot receive vaccines. Troyan claims that if the whole population were to be vaccinated, it would better protect the unfortunate who cannot be vaccinated by lessening their chance of exposure to the illness. In addition, he claims that if people were to stop getting vaccinated altogether, death rates would revert to their previous levels at the beginning of the century. Diseases would be facilitated in spreading at more rapid rates and have greater detriment. In order to achieve herd immunity against an infectious disease, you must immunize at least 80% of the population. This will guarantee that the rate of disease transmission would be slowed down enough that it could be stopped and enabled. This led to the eradication of smallpox. It has also reduced the transmission of pertussis and protects against influenza and pneumococcal disease.
An unimmunized person travels to a place where one of these diseases is circulating and then returns to a community with other similarly unimmunized people. And boom, we don't remember what measles or polio or hepatitis B looked like and felt like.
As everyone can see, whether to be vaccinated or not to be vaccinated affects the society as a whole. It also helps the whole via herd immunity. Therefore, some argue it is our civic duty to vaccinate, where there are others who still feel differently. Now, the decision is up to you. To be overcautious or not cautious enough.